بالله من الشيطان الرجيم بسم الله الرحمن الرحيم رب اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي. If you have any questions, you can ask. I'm going to make my presentation, but if there's anything that I needed to explain while we go through, please ask, or if you want to wait to the end, that's fine as well. So I'm going to talk briefly about advances in modern dentistry. As we all know, dentistry is part of the person's general health and particularly oral health. My screen is not okay. Let's see. So as we usually know, the major diseases that we have in the mouth is decay and gum disease. We know that gum disease causes the loss of the periodontal attachment, while dental caries impacts the hard tissues, which are the teeth. The dental decay is the most prevalent disease worldwide. Of all diseases, it's number one. And there are very few people who do not have dental decay. Traditionally, we use an explorer, which is a device that has a pointy tip to detect decay. And basically, we use it in a mechanical form. And that mechanical form is we go and see if there are grooves on the teeth or discoloration on the teeth, and we use a certain pressure amount, usually want it to be about 20 grams, and see if the tip of the explorer goes inside the cavity and sticks. If it's sticked, then we consider it as decay. Now, there are newer methods and better methods for that. One of them is a laser Doppler, which uses like laser wave to detect decay, and then it gives you a certain reading on the device. The transillumination devices are devices that detect color change within the tooth to detect decay. Basically, when we lose the minerals, basically the decay process is a bacterial acid attack on the tooth structure, and that removes the minerals from the tooth. So that, in essence, changes the amount of minerals and also changes the transillumination characteristics of the tooth. So these devices can detect the color change of the tooth once light is transmitted through them, and then detect the extent of decay. Of course, intraoral cameras as well do that, whether some of them use it by creating a better image of the tooth, and also there is some fluorescence settings on these devices that help detect decay. There are now intraoral scanners which are used in CAD/CAM dentistry that have as well a feature of detecting decay. And if you see here, this is like a software analysis of X-rays using and detecting decay. So also there are some softwares that help as well. Now, one of the it's not very new, but it keeps evolving, is the use of CAD/CAM dentistry, dentistry is big now in digital dentistry, and digital dentistry can mean many things. One of them is the CAD/CAM dentistry, and the CAD/CAM is computer-aided design, computer-aided manufacturing of restorations in terms of dentistry. Of course, it's used in a lot of industries, aerospace, pretty much everything is CAD/CAM, car, auto, pretty much everything uses some form of CAD/CAM. The use of dentistry has been now over 30 years, but in the last 10 years, there's a huge improvement in the accuracy, the speed, and the ease the ease of use of CAD/CAM softwares and CAD/CAM devices. Now, what does CAD/CAM dentistry do? It's shorter appointments, faster turnaround time, improved precision, and that also results in longer life restorations. There are a lot of materials that are made specifically for CAD/CAM devices, and with the improved precision and speed. And one thing that we have in dentistry is that the closer we are to like the smaller the gap between the restoration and the tooth, the higher success that restoration would be. So using CAD/CAM devices, because we're scanning at a higher precision than just regular impression materials, we are milling at better tolerances and smaller tolerances than we do when we fabricate restorations by hand. And with the improved bonding techniques that I will talk later about, we are having better restorations. And a restoration means anything that will fix a tooth. So a restoration could be a filling, could be a crown, could be a veneer, it could be a crown on an implant. So anything that restores function or looks is considered as a restoration. But CAD/CAM has opened new venues in terms of speed, precision, and also as well aesthetics. The looks of the restorations have improved quite drastically with the use of CAD/CAM technology. That doesn't come at a low expense. Most devices are about 100,000 or more for that, or the setup is quite expensive. And you don't have, like, not all dentist offices use a complete system. Some use scanners and send to the lab, and the lab fabricates via digital technologies and computer assisted design and manufacturing, or aided design and manufacturing. So you can mix and match sometimes, but the general rule is that we have quite improved our aesthetic outcomes and functional outcomes with the use of CAD/CAM dentistry. So with the, now we're having better ceramics. Sorry, this is the wrong picture, but when we are doing certain ceramics, now the ceramics are the white filling materials. Usually ceramics are not direct restorations. So there are direct restorations, which are the fillings, and there are indirect restorations, which are the ceramics. So if we look at the ceramics, we have newer ceramics, more dense. The process of manufacturing ceramics have gone way better in the last 10 years. We have the new formulas of ceramics. We have stronger ceramics, and stronger ceramics mean that we are having thinner restorations. What does that mean if we have a thinner restoration? It means that we are reducing less of the tooth structure in order to protect it. So generally full coverage or partial coverage restorations, which are crowns or veneers, inlays or onlays, are restorations that we have to remove part of the tooth structure most of the time, not necessarily all the time, but part of the tooth structure, and replace it with a ceramic material or an indirect material. Now with stronger ceramics, less flaw in their manufacturing, we have improved and reduced the amount of tooth material that we have to shave off in order to install or to put these ceramics on. Now, also, we have improved the aesthetics of these materials. So the color match, the color blend, there's something called shade degradation. So we're able to give more pleasing, more natural looking restorations as a result of using such newer ceramics. With also using the CAD/CAM manufacturing process, we're having less defects and more streamlined process, which reduces errors in the fabrication process. One of the things that has changed the way dentistry is done, and we've been doing bonding for over 30 years now, but the concept of bonding to dentin is about 22 years to, let's say, approximately, some started talking about it 30 years, but bonding to tooth structure. We in the past used to bond to enamel, thinking that that process is more stable, which is true. But bonding to dentin, and the tooth is made of enamel, which is the outer shell layer on the top of the tooth covering the crown. And then we have dentin, which is the inner area of the tooth that surrounds the nerve of the tooth, the nerve and the blood supply that comes to the tooth, and that's called dentin. And it covers the root. There's a thin layer called cementum, which is the outer covering of the root. But in general, we are bonding to either dentin or enamel when we're doing a filling. Now I'm talking about the tooth-colored fillings, because the amalgam fillings have lost a lot of their appeal because of concerns of the mercury and mercury release, even though most studies, like real good studies, show that the mercury release is very little and doesn't drastically impact the health of patients. And there's nothing really strong proof to say that the amalgam is bad for someone's health. But that concern, and also from the looks of the amalgam, because it's kind of more silver gray and gets darker with time, that you hardly have any patient who wants amalgams. So now we have direct and indirect restorations, and the way we glue them is through bonding. Bonding is a mechanism where we create, we have two things with the bonding. One is a chemical bond, and the other one is called micromechanical bond. And the chemical bond is basically the two materials have a chemical affinity to one another, which gives, if existent, gives a very low amount of bond strength. So the glue doesn't really, the gluing process or the attachment process rarely depends in its entirety on the chemical bond. But the one important feature is that we create a macromechanical retention. And the macromechanical retention is basically with using an acid on acid-like material that creates some roughness within the tooth and remove some minerals, where a resin penetrates into that material, which we call it the hybrid layer or the hybrid zone, where it's made of a resin material that penetrates through the dentin, and then which is basically in this zone, and then we see that there's a filler material here on top, and with that we create that bond or macromechanical bond between the restoration and the tooth. So this way the restoration will stick to the tooth and reduce the chances of leakage. And leakage basically is the passage of fluids and bacteria between a restoration and the tooth structure, which creates a secondary decay and loss of the bond between the restoration and the tooth. So now we have better bonding agents. Our understanding of the process itself has quite improved, and we are getting to to have longer lasting restorations. And that has led to different things. For example, we used on crowns, we used to depend on a full coverage and on a basically mechanical retention for the crowns. Nowadays, we are not relying on that. We're basically relying on the micromechanical retention and the bonding ability of the material. So we're not cutting as much of a tooth structure as we used to. Now, with the filling materials and convertive materials, with the filling materials and bonding materials, we're having a great shade selection. So basically, even with direct restorations, we can create a lifelike restoration on a patient, something that even sometimes an expert eye cannot detect where the filling begins and where the tooth ends, or vice versa. We can do very conservative change of the shape and the color of the teeth with these restorations. We can use addition even without any reduction to change the form and the alignment of the teeth. So we have much better materials nowadays. Of course, there is some research to create an enamel-like and a dental-like properties and materials, self-healing materials. And if we had time, we can talk a little bit about that. One also big advancement in dentistry is that we have better dental implants nowadays. We have better understanding of dental implants. We have better materials, better mechanics, and better design for those. And we can successfully replace missing teeth with high predictability and long-term success through dental implants. That doesn't by any means mean that we should neglect our natural teeth. Our natural teeth are the best true thing in our mouth. But in terms of replacement, when teeth cannot be saved, dental implants offer a great solution for the success, and in terms of success and in terms of the looks and the feel of the patient. Generally, it depends on the area of the mouth, but generally on average, we have a 95% success rate on implants. Of course, anterior implants, and especially if we're replacing a single central incisor, that's the most difficult restoration generally. But we have good success rate, especially if we go in posteriorly, because then the aesthetics are not as crucial. And we have now newer biomimetic approaches. We have improved in our regeneration. We have improved in our smile design and execution. So there are a lot of newer things that are in the implant industry that leads to great success. We've heard about teeth in one day. We've heard about a lot of replacements that reduce the amount of waiting. I'm not saying that teeth in one day is exactly the ideal solution for everybody. It is for some and not all, but we can now predictably replace teeth through implants and improve the function and the life quality for those who have lost their teeth or some of their teeth. As I talked earlier, that gum disease is one also of the most prevalent diseases in mankind. They lead to tooth loss as a result of the loss of the connection between the tooth and the bone. Because once we have periodontal pocketing, the progress of the disease, if it continues, then that attachment between the tooth and the bone is compromised, and then we have some mobility. And if that's not fixed and it keeps progressing, then it leads to eventual tooth loss. Generally, we do mechanical treatment at the beginning, which is the removal of the tartar, because the tartar is the major offender, because bacteria that's on the tartar and the plaque that accumulates over the tartar is the one that causes the movement of bacteria down through the pockets, creating deeper pockets, and the inflammation process that leads to the loss of the periodontal tissues. Now, we have several techniques and several materials that help us with this. Lasers are a big advantage now. The use of lasers has big advantage in terms of cleaning the depth of the pockets. It also helps us with the regeneration. We have membranes and bone grafts and some proteins that will help us. We have certain antibiotics and local delivery of antibiotics that help us with gum disease. So there are a lot of options that are available now in terms of treating periodontal disease. Of course, prevention is always better than cure, so regular visits to the dentist in dealing with periodontal issues early in the process help quite a bit. Now, with dentistry, there are other things that we have. The introduction of artificial intelligence into dentistry has changed a lot of things. For example, we can make better treatment decisions using artificial intelligence. We have better documentation. We have also better interactions. So artificial intelligence is present currently in dentistry. It improves decision-making and decision-making process into the treatment, material selection, approach, and all of that. So we can make more informed decisions and better customized decisions for our patients. One of the things that are available as well is smart toothbrushes. They are available in the market, and those smart toothbrushes can give you a lot of information about your brushing habits, your technique, the pressure that you are putting on your teeth gives you instant feedback as well. Those toothbrushes can give you reports on how much you've done of your toothbrushing, the areas that you did, your motion and everything. So there is a lot that's available now with smart toothbrushes that help improve the oral health. Now, in dentistry, we also have what we call as augmented reality. And the augmented reality is basically or mostly used in terms of training, and we can train our students or dentists on new techniques using augmented reality. This improves the outcome of the training itself and the outcome of treatments. About the virtual reality, basically, virtual reality can be used to reduce the anxiety of the patients. And we know that there are a lot of patients who have dental phobia. So we can basically, with the headset devices, put them in a place that's different than they are and reduce their fear from dental treatment. Of course, this could be done with or without oral sedation or the use of gas and other devices that we traditionally use in dentistry, or tools that we use traditionally in dentistry. But at our office, we just have TVs that are on top of the patients, and we see that just having the TVs without the virtual reality, it reduces the stress of the patients and give them a little bit more of a relaxing experience. There are ways of, a lot of people are scared from needles, but there are ways to have needle-free local anesthesia. And this is basically by creating a current that goes through the gums and the teeth, and it desensitizes the nerves. Then you can do certain procedures. Previously, we had such a device, but we did not feel that it is as efficient as just the regular injectable anesthesia that we give. Now, there are some studies, of course, dental disease and the mouth, the mouth and the body are all connected. So some of the newer findings is that low testosterone leads to or have a higher connection with gum disease. And this is a study that was done at the Texas A&M University College of Dentistry, where they found in male monkeys with low testosterone that they have higher gum disease compared to the ones with a normal level of testosterone. One of the advantages also that we have some bioactive glass filling materials. These are materials that mimic nature in a sense, and those are, even though the process is still at its infancy, but those are self-healing materials, so that if there is a crack in the material itself, that material self-seals its own cracks. And we know this is also used in regenerative medicine as well. There's a link between gum disease and esophageal cancer. Basically, certain bacterium that is inside the gum and cause gum disease, there's a higher propensity if we have that bacteria. When we compare, if that number of that certain bacterium is there, there's higher chances of having esophageal cancer. There's a link, of course, between gum disease and heart disease. And there's also a link between gum disease and lower birth weight babies. So mothers who have gum disease and periodontal disease, they are associated with low birth weight babies. There are some studies on replacement therapy, so that certain bacterium could be inoculated inside the mouth to reduce the bacteria that causes dental decay. Still in its infancy, but some expect that there will be some anti-cavity pills that people will take so that they reduce the chances of gum disease. All right. One of the things that is important, and parents, especially with younger kids, that bottled water could harm dental development, especially if we have less fluoride content. And there's also some materials within the bottled water as a result of it being bottled that impact the dental health and dental development in children. There are some concerns as well on fluoridation and over-fluoridation, but generally fluoride is a very important element in the dental development and the dental health. Now, people who are mouth breathers, they have high risk of both tooth decay and gum disease, because basically mouth breathing reduces the flow of saliva and the production of saliva, and it causes dryness of the mouth. And dryness of the mouth is very harmful to both gums and to teeth. There are some studies or newer studies that say that certain salivary enzymes are a good treatment, or maybe a treatment for celiac disease. So again, when we are talking about this, we understand that there is a strong connection between the oral health and the general and systemic health of individuals. This I end my presentation. If anybody has any questions.
Brother Raed, you did an excellent job. I have a couple of questions, but I will let other people talk before I ask questions.
Yes, please, if anybody has any questions.
Since the floor is open, so can I ask, go ahead with the questions?
Yes.
Okay, good. Very nicely done. It's awesomely great done. A couple of things before I ask question, I can add a couple of things. Is that okay with you?
Yes, please. Yes.
Okay. So as you mentioned about different things over here, in geriatric psychiatry, what we have found is a close relationship between the gum loss of teeth and dementia, especially Alzheimer's dementia. So we're going back to the NUN studies. There's a famous NUN study done on close to 400 patients who are 800, yeah, and they were aged from 85 to 105 years old. And this NUN study is a very famous study. A lot of results came out. One of the findings they came out that amount of teeth loss were directly related to dementia. So the more teeth loss you have, the more likely chances of developing dementia. They are unable to find it was it the gum disease or the tooth decay. They were not able to find. They have not differentiated that out. But as long as you have more loss of teeth, you have more likely chances of developing dementia. So that's a very big, solid study coming out that has been published already more than 5 years or 10 years ago. So that's one thing. Other thing which we know in geriatric psychiatry is that, there's a lot of bacteria who grows in your gums, and if they get a chance by inflammation or by interleukin and all those things, they can go back into your brain and start developing the neurodegenerative process or dementia process. So that has been pretty much confirmed, and they are looking into different type of bacteria or viruses which does that. So good health, dental health is extremely important. for a geriatric or any adult or even a child also, because down the line there's a huge consequences comes with that. A couple of disease like from the dental is the slow viruses, which is very Krupp-Jakob disease is very common. I have seen a couple of them. So that's from the dental procedure. So I liked Brother Raed to talk about that because that's pretty fatal disease happened. Anyhow, so that is also linked to dental procedure or dental diseases and going to that by the slow viruses. So yes, psychiatry and geriatric psychiatry has informed us a lot of things about the dental decay and all those things leading to neurodegenerative disorder. So we need to take good care of it. The other thing the question which I have is, you mentioned about the testosterone level, low level, leading to gum disease in the monkey population. Was that in the human population? Has they looked into that, or just primates?
So far, it is primates. I'm not sure if there's any new publications on humans, but what they found is that male monkeys with less testosterone have higher gum disease level.
Okay, so it's evolving, and we have to look into the human model. Okay, that's great. Other thing which you mentioned is the salivary enzyme in the celiac disease. That's really important topic. So we, as Rehan also said, that H. pylori, which we used to do all those things, it's very strongly associated with height and the weight and all those things, which comes from your mother. And it's in the salivary gland of the mother, and it passes on to your kids, and it runs from that. So it's very important. That's H. pylori, which is being used in the family to run that. So that is where it's going, that we try to get rid of H. pylori, but H. pylori is very healthy, very helpful until it goes out of control, and then you have a consequence behind that. So that's one thing. So if anybody has any question regarding what I said, I'm ready to answer that.
Yeah, I'm just gonna follow up on what you said in terms of the non-study that you are talking about and oral health. Of course, a person's attitude towards oral health is an attitude toward their general health. So if we really do care about our oral health, I think individuals who do that, you generally are more careful about their general health, their lifestyle, what they do. Of course, we know there's a relationship between the oral health and also quality of life. So people who have lost multiple teeth or have gum disease or issues with their teeth, they usually have a lower quality of life just because they cannot chew efficiently, they don't feel healthy, they miss a lot of opportunities in terms of eating the foods they like or eating healthier foods and things like that. So it's all interconnected, I believe. And this is what we're seeing. The more we link dentistry and medicine together, the more we see the connection of oral health and general health.
One more thing I'd like to add on that chewing is 40% of digestion. A lot of people don't understand that. Means, the way you chew and how you chew and all those things has a lot of meaning behind that. And I think so that is totally lost nowadays, that we chew as fast as we can and swallow it. That's not the right way of doing it. Because basically you chew for good enough so that it breaks down completely. So when it goes to the stomach and all the places, it can get absorbed very well. Like for instance, what we have also found is that carbonated drinks are not good for your teeth. So as we have found that carbonated drinks are also leading to neurodegenerative disorder, because basically the absorption of a lot of elements which are required, which are essential, does not get absorbed because of carbonations. And so that is very essential for your body. And later on, they develop dementia. So B12 vitamins and all those things, at what enzymes are released in the stomach and small intestine to absorb, that does not get absorbed properly because it's carbonated. So it does affects your teeth, affects your B12 absorption and all those things. Later on, B12 deficiency can cause neurodegenerative disorder. So, and also other important elements are not absorbed. So it's very important how you chew and what you eat or what you drink that leads to decay of your teeth as well as neurodegenerative disorder.
Yes, that's so true. Because as a surgeon, I have operated on many people with small bowel obstruction, swallowing a cucumber because they did not chew it well, and obstruction in the esophagus, again, they didn't chew it well. So these things lead to complication later on. Chew your food well, man. That's what, enjoy your food.
Assalamu alaikum, Brother Raed.
Wa alaikum
This is
assalam wa
Arif.
rahmatullahi wa barakatuh. How are you, Brother Arif?
I wanted to know any particular food that is good for, your teeth and fruit. So
Yes, and I'm not sure if there is like a highly recommended list of foods. Of course, traditionally we know that apples are good, right? So basically, what we need to do when we need to eat a balanced diet. As Brother Najeeb mentioned, that chewing efficiently is very important, because chewing less is related as well to overeating. So we basically, we're loading a system with pretty much unchewn food, and then we are overeating because we're not giving ourselves the chance of feeling full before we have stuffed our stomachs as well. So one of the things that we need to do in terms of preserving the teeth is that there's a time limit between when you eat something and then when that food and the carbohydrates that are in the food is changed from with the oral bacterium into an acid, and this time is about 5 minutes. So once we finish our food, within 5 minutes, it's good to go to brush our teeth. Of course, brushing the teeth as technique is also very important. So using an ultra soft toothbrush is important, having a vertical or a small circle motion, and being thorough when we brush the teeth. These are very important. In terms of certain diets, I would say a balanced diet that contains fibers, chewing on both sides of the mouth, because some of us choose on one side, or if somebody has a pain on one side, then they chew on the other side, and that causes a lot of problems, actually, usually on the side that the food is not being chewed on. It causes gum disease there, it causes accumulation of tartar and all of that. So it's good to address these issues early.
Yeah, other question I have is, frequency of eating. Is it, some people like a munch all day a little bit, and some people just take like 2 meals a day. So which is good for your teeth in terms of, saliva, acid production and all that?
Okay, Brother Arif, I'm not 100% sure, but now we are talking about smaller meals and more frequent than a couple of meals. Now, one thing that is I see with patients who have high caries rate is that they sip on certain drinks for a long period of time. And we have a buffering capacity in the mouth. So people who, for example, sip on certain drinks, whether it's sugar drinks, carbonated drinks, juices, over a lengthy period of time. So some people will leave a Coke bottle or sweetened tea, and they just sip a little bit, and they do some work, then they sip a little bit. That basically compromises the buffering capacity of their saliva, because they are continuously injecting carbohydrates or acid components or acidic components into the mouth that the saliva cannot catch up with, and that causes tooth decay. So basically what I usually advise people, especially kids who like to drink juices, is that drink the juice with the meal, not separate from the meal, and no sipping. And for adults, the same thing, no sipping on carbonated drinks, no sipping on juices, no sipping on sweetened coffees or teas and things like that. So it's better to take the whole thing together rather than taking it over time.
And one last question: how important it is to get the wisdom tooth out in your teenager or young child?
Okay, a very good question. Now, in terms of wisdom teeth, it depends if they have space or not. Now, with the human evolution, how we changed our diets, and thus we changed how our teeth fit in our mouth. Basically, in the past, because most of the food was not overly cooked or processed as we do now, there was more friction between the teeth and the food, so that caused wear between the teeth, because the teeth moved more, and we had stronger jaws and bigger jaws as well, just because of the use. In the modern man, let's say, we have less wear, so we have smaller jaws and also wider teeth, in terms of that the teeth, the areas that between the teeth are not kind of rubbing against each other, and there's less wear. So we generally don't have as much space as we used to thousands of years ago. So when there's no space and the teeth are causing issues, it's better to get those wisdom teeth early, just because the bone is softer and it's easier for the teeth to be removed than when at a later time in the adult life, where bone is more dense and it's harder to get these teeth out. Did I answer your question?
Yes. And is there any cutoff age that you should do it before a certain age?
There isn't a cutoff age, but somebody who's in their teen age compared to the same person if they were in their 40s, extraction of their teeth when they're teenagers would be much easier and less traumatic than when they are in their 40s, just because of the density of the bone and also the amount of tooth development as well, because the roots at 40 will be fully developed, while in their teenage, most probably they're not fully developed, so it's easier to pull these teeth out.
Okay, excellent. Thank you.
You are welcome. Thank you.
Right, Raed, can I add something on this?
Yes, please.
Okay, so regarding on-the-go eating, like when a lot of people start eating really fast and they are on the move, so they're not spending time sitting down and eating in a proper way. And what we have seen that they become like overweight and all those things. So the reason behind that is your stomach and your GI tract produce two enzymes. One is leptin and the other is ghrelin. These are enzymes very important, and it gives the feedback to your brain that you have eaten enough. So it takes 30 minutes before they give you the signal back that, hey, your stomach is full, it's time to cut off. So when people are not chewing properly and eating really fast, that hormone is going to take its time. It's not going to wait till it's expand and it's usually time duration. So it's very important that we eat properly, give enough time so that hormone kicks in and it tells your brain. So there's different ways the brain realize that you have filled up. It's not just filling up the stomach, but also from the hormonal basis, which is leptin and ghrelin. That's an interaction of these two. Very important. So that is lost because if you eat in 5 minutes, huge amount, leptin and ghrelin is not going to work at that time because it takes a sweet time of 30 minutes. So that's one of the good reason we need to sit down, eat properly, chew well, and chewing well is extremely important because when it goes to stomach and other places, although the pH is 2 or 3, does not mean that it's broken up completely. It will try to break up, but still, if you physically break up with the teeth and mixing with saliva, it's much easier to digest and get absorbed, and all those the intrinsic pathways and all those things, which also helps with the absorption of a lot of other things. So that's very important. The other thing which you mentioned, which is I'm hearing two sides of the story. So somebody who eats and then brush after 5 minutes, I was told that wait for a little bit longer because your enamel, it's very hard for your enamel just after eating. So can you elaborate on that? Because is that true that you should, wait longer or just brush after 5 minutes?
Very good question. So what I said, you have the 5 minutes. So you want to brush before the 5 minutes. Okay, so those are the 5 minutes that the pH of the mouth will fall below the critical pH, which causes the dissolution of the minerals from the tooth structure, right? Now, if you took more than 5 minutes, it's better to wait, because if you did the brushing now and the enamel is already softened, then you're brushing away, or the tooth structure, let's say enamel or dentin, you're brushing away that softened part that's already softened with the acid that's in your mouth. So it's better to wait until your pH is neutralized by the saliva, and then you do the brushing.
Thank you for that. This is a delicate dance.
You got to that point, right?
Yes, I totally got the point. It makes a lot of sense to me. So
Yes.
do it before 5 minutes or wait for your turn, like after 15, 20 minutes then.
Exactly, until the buffering capacity of saliva catches up with the acid production, and then the enamel is not softened, or the dentin, the exposed dentin is not softened, and you're not brushing it away. So it's either you rush before the 5 minutes or you wait till later.
And somebody provide you with a sweet dish and then you have to brush again. I'm just kidding.
One thing that we forget, the Prophet ﷺ mentioned about brushing the teeth, right? And he said, لولا أن أشق على أمتي لأمرتهم بالسواك عند كل صلاة. If I didn't want to burden my ummah, it's because I didn't want to burden my ummah, I would have ordered them to use the miswak with every prayer. And I don't know if you guys are aware of or not, but now there are some companies that sell the miswak as a cool thing, and it's like cool for teenagers to have that natural thing and all of that. So they're making business out of it. But if we look at it, the Prophet ﷺ told us about how we care about our health and general health and the importance of it as well. But he didn't make it obligatory on us. He rather recommended it for us. So I think taking this as a guideline is a good thing as well. Any other questions or comments? All right. If there isn't any, we are 9:29, so almost 9:30. We can make the dua, and inshallah, we will meet next week.
Brother, do we know who's presenting next week?
Yes, it's Brother Asif Hussein. He's going to talk to us about the Iman and Akhlaq and the Prophet Sallallahu Alaihi Wasallam reaction when things upsetted him. So inshallah, Brother Dr. Asif Hussein will be our speaker next week.
Great, thanks.
بإذن الله. جزاكم الله خير. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك. سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين وصلى الله وسلم وبارك على سيدنا محمد وعلى آله وصحبه أجمعين. السلام عليكم. جزاكم الله خير, all of you, and inshallah we'll see you next week.
Jazakallah, very nicely done.
Jazakallah. Thank you very much for the information.
السلام عليكم.
Assalamu alaikum.